Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. So in today's episode, it's going to be extremely special because it's episode 1 of the Spotlight series. Meaning, I'm going to be spotlighting several different medical professionals and actually giving you an example of somewhat of what they go through, telling them about themselves, and just giving them a spotlight on my channel and being able to spread the word on what they believe and what their process was like. And today is special because we have Fabius. So he is a Psychiatric NP. He recently just graduated and he recently just passed his test, his ANCC exam. Well, special shout out. So let's go get this video started and ask a bunch of questions and we'll go from there. So stay tuned, everyone. Welcome to the channel, Fabius. So for all of our Psych Dude family, tell me a little bit about yourself.
Hey guys, my name is Fabius. I'm a psychiatric nurse practitioner. I just passed my board exam last Tuesday, graduated over a month ago. I'll be starting my new job in outpatient psychiatry in, I guess, over a month. So right now I've just been relaxing. Super happy that super stoked that I passed the exam. So I'm floating on cloud 9. I just want to introduce myself, give you a little backstory on me. So, when I was younger, my dream was never to be a psychiatric nurse practitioner. I wanted to be like an athlete. I wanted to be like a boxer or whatever, as a little kid, what you want to be. I was 19 years old, 20 years old. I was in college. I was a college athlete. And I was a business major at the time. And I was kind of at a crossroads in my life. I didn't know what I wanted to do. And there was a time where my grandma was really sick. She got diagnosed with terminal cancer. And my there's so many people in the healthcare field in my family, and they were taking care of her. And I kind of sat back from afar and I watched them, and I was so humbled, and I just watched them take care of her the best they could. And I wish I could have just did a little bit more. I was there for her, but I wish I could maybe prescribe medication or just do something. And after that day, I did a complete switch. I switched from business to nursing. And it was the best decision I ever made. So I was in nursing school, and I remember I loved mental health. It was my favorite clinical. And that's what I wanted to do. I wanted to become a Psych RN, but all my clinical instructors were telling me you should work in a medical unit first to develop skills, and you'll be more marketable to other employers. And so, I graduated, I passed NCLEX. That was an awesome, I was so happy about that. I got my first job, but I got a job in surgical intermediate care / ICU. And I did that for over a year to 2 years. And I was not happy doing it, but I did it just to build my skills up and I guess boost my resume. Once I was done that, I found a job in inpatient psychiatry, and I was much happier. But after a couple of months, I was just thinking, I just felt like I could do more. And I started looking up at Psych NP programs, and I kind of decided at that time I was going to go from full-time to part-time, but I was going to go back to school. And that's what I did.
Dude, that's so awesome. Thank you for explaining about your background. So just to go a little bit further, so why exactly did you want to become a Psych NP? Out of all the other careers, why did you want to become a Psych NP?
Why did I choose to become a Psych NP? I liked being an RN, but I think with me, I guess I got tired of taking orders, or I just felt like I was just following the rules, and I didn't have much autonomy. I did what the doctor asked me to do, and I guess I just wanted more responsibility, more autonomy. So I knew that I liked mental health, and I figured going to the Psychiatric Nurse Practitioner program would be perfect for me. And that was a big thing for me. I wanted to be able to take care of my patients how I wanted to do it. I wanted to, prescribe medications. I wanted to be able to diagnose. I really wanted to do everything on my own. I wanted that pressure to have to do that. And that's the main reason why.
Nice. So based on being a Psych NP compared to being a Psych RN, what do you like best about being a Psych NP over being a Psych RN?
What do I like better about being an NP versus being an RN. So being an RN, you learn so much. You learn so many skills. You learn about medication, side effects. You learn a lot. It's really important to learn a lot when you're as an RN. But as an NP, it's almost like a completely different set of knowledge you have to learn. You have to learn about not only these side effects, but you need to learn about these doses, and you need to learn about their diagnoses, and you're in control of this patient. You're prescribing them the medication, you're diagnosing them, you're titrating this med, you're seeing them for follow-up. You're really, really responsible for their care. And for me, that's what I wanted. I wanted that pressure. I wanted to have that responsibility. It's a completely different job role, but it's something that I'm a lot happier in, and I get a lot more satisfaction in. Also, you get paid a lot better, which is a really big thing. And to me, the role I have, I have my own office. I see patients every 30 minutes for medication evals, 1 hour initial evaluations. I have a lot of time with patients. As an RN, you're juggling 6 patients, here in Maryland, and sometimes you don't even have time to talk to one of them very much because one of your other patients are really struggling, or it was hard. To me, the fact that I got to kind of dictate what I wanted to do, that's what I really like about being a Psych NP versus being an RN.
Yeah, I know. School's probably really tough, especially having to go through all that. So what do you think the biggest challenge from working as an RN and having to go to school as an NP at the same time?
Working as an RN and going to NP school. That's definitely a little bit more difficult. I think as you get older, you're a lot more responsible than when you were, getting your bachelor's and you're still going out and partying and all this other stuff. So you have your job, but you really have to be really good with your time management. You're going to be working several days a week. You need to make sure that you're getting your work done. You have discussion posts, papers, exams, quizzes. You have to kind of outline your calendar, your syllabus, and you have to look at it beforehand. And you need to make sure that if this is due by Wednesday, I'm going to make sure I get it done by Wednesday. You need to have a big outlook on, maybe there will be some weeks which will be more busy. And if that's the case, you sacrifice. You don't. Maybe you might not have much of a social life. I'm pretty fortunate. I don't have kids or anything like that right now. So, I'm just worried about myself. But you have to really be cognizant about your time. Time is precious, and if you're gonna be working, you have bills to pay, all these other things. You have to do those things, but you can bring your laptop, or you can do some schoolwork, on the computer when you're at work. When you have downtime. It's really about time management. That's really the biggest thing.
Yeah, that definitely seems tough. But a question that I get often is, how do you maintain that work-life balance? And for me, I was able to just do the things that I actually wanted to do the things that I love, and maintaining that work-life balance, especially when going through a rigorous program like myself. But for you, what do you do to maintain that work-life balance? Whoa. A simple answer would have been totally just fine. You don't have to take off your shirt and work out. Just saying. I'm just messing around. But so what do you do to maintain your work-life balance?
How do you maintain a good work-life balance? I'm not one of those guys that could pick up a lot of extra shifts. That's not me. I work my shifts and I don't pick up anything. To me, my life outside of work is really precious. And, I'll still hang out with my friends. I'll go to the gym. I'll play guitar, play music. I think you need to have a good work-life balance. It's you don't want to be miserable. You want to enjoy life. And I think some people can do it, but that's not me. When I was studying for the board exam, I was going to the gym every morning, and I would also study at the library from like 10 o'clock to 5 p.m. And but those two are like the main constants in me passing that board exam. I studied hard, but I hit the gym hard, and then I would just repeat every day. To me, you need to have some sort of balance. You need to go out with your friends every once in a while. You need to relax. You need to enjoy life. And then once you pass the board exam, then you're working. It's everything you worked so hard for. It's good.
Hey Fabius, thank you so much for being on my channel. I'm sure everyone had a good glimpse of your life, your background, and I appreciate that. And Psych Dude family, if you are interested and you want to be featured on my channel, definitely reach out. I'll be more than welcome to collaborate with you, and so you can be featured on my channel. So as always, have a wonderful day guys, and don't forget to like and subscribe, and don't forget to click on the bell button to be notified, and follow me on Instagram at The Psych Dude. And also you make sure you follow Fabius too on Instagram at ThePsychiatricNP. We'll have a wonderful day guys. Bye.